today I'm going to be doing like a head and face exam on you today. So first I'm just going to start with inspection of your skull and head, looking at the shape of your skull and head size in proportion to your body, and then any like tilting or anything of it. I'm also going to look at your facial expression to see if you're in any pain or anything. You look pretty good right now, or any emotional distress. I'm also going to look at your eyes and eyelids and eyebrows, just checking for asymmetry, pupil symmetry, no thinning of hair on your eyebrows or anything. That looks good. And then I'm also going to look just at your nose and mouth again, just looking for any asymmetries or any unusual pigmentation or colors. All right, and then next I'm just gonna look through your hair, if that's okay, to just check for normal. Here I'm just checking between the hairs, looking for any nits or, well, I'm here I'm also palpating for masses and tenderness. Does anything hurt? You have anything? All right, and just normal hair quality. Good, and then I'm also going to next palpate your parotid glands, which is just along your cheekbones, if that's okay. So I'm just gonna use my fingers and palpate for any unusual masses or swelling. That feels good. And then I am going to auscultate your temporal arteries next. And usually I wouldn't do this unless the patient has like signs and symptoms of headaches, dizziness, or stroke signs, but I'll just do it. I just take the bell of my stethoscope and listen bilaterally to your temporal artery for about 5 to 15 seconds, listening for like signs of brewery. So I do this on both sides. Good. And then I'd also do it over her eyebrow for the orbital arteries. I'm gonna have you close your eye. I'm just gonna gently place this over your eye. Good. So same thing there, just listening for brewery, signs of brewery. Next I'm just gonna do a trigeminal nerve assessment. So I'm gonna just feel places on your skin. Just let me know if it feels same or different. Go ahead and close your eyes.
Same. Same. Same.
Good. And then next I'm going to check for her corneal reflex. I would usually use like a sterile Q-tip, but I just have this for now, so I'm just going to pretend to elicit the reflex, watching for my patient to blink. So go ahead and look away from me, and then I just touch your eye, watching for her to blink. And then I would grab the next one and do the same thing on the other side, so go ahead and look away, touch the eye, and watch for her to blink. And then I'm going to do a mastication test, so go ahead and open your mouth and put this between your teeth. No, I can use it. Okay. And then just don't, and then bite down and don't let me pull. Good. And open on the other side, same thing. And good. So that's testing for mastication. And then last thing I'm gonna do is a facial nerve assessment. So I'm just gonna have you wrinkle your forehead. Good. And then put air in your cheeks like this. And then smile for me. Good. All looks good. So now we're going to be looking at your nose and mouth. So first I'm just going to start again by looking at your nose, looking for any asymmetries or unusual alignment externally, and it looks pretty good. Then I'm going to go look internally with a speculum and my otoscope. So I'm going to turn this on and look inside your nose, if that's okay. Turn my light on, and I'm just going to get in and put it in the nose. Here I'm just looking for colors of her nasal mucosa, the septum, and the turbinate color. Everything looks good. And then next I'm going to have you do the nasal patency test. So go ahead and just cover one nostril with one finger and breathe in. Good, and the other one. Sounds okay, just checking for any obstructions. And then next I'm gonna just palpate your sinuses, feeling the maxillary and the ethmoid sinuses, or frontal sinuses, sorry. And do you have any pain with that?
No.
And then I'm going to percuss them as well, just tapping with my fingertips. Any pain? No. Good. All right, then moving on to your lips and mouth. So first I'm just going to look at your lips, looking for any unusual colors, moisture, any cracking or things at the corners of the lips. It looks okay. And then I'm going to use my tongue depressor again, and I'm just going to have you open your mouth for me. And I'm just going to check her gums, her teeth, and her tongue, and then the other side, teeth, gums, and cheeks, looking for any unusual colors, bite marks on the tongue or cheek, and then just teeth and gums, making sure they look healthy. And then next, I'm going to be grabbing your tongue with this, and then I'm just gonna move it around to check for any unusual things in your mouth. So go ahead and stick out your tongue, open your mouth, so I'm just gonna grab it, and I'm gonna look on both sides of the tongue, and then the hard palate of her mouth, and then underneath, Good. Looking for any things there. And then I would be wearing gloves during this too. We just didn't have any. I forgot to mention that. But next I'm going to try to elicit, I'm going to look at your pharynx first. So I'm just going to depress this and have you say ah for me. Ah. Good. I'm just looking for the uvulator eyes. And then I'm going to try to elicit your gag reflex. I'm going to pull it back. Watch for your gag. Good. And then just last, I'm gonna have checking her hypoglossal nerve. I'm just gonna have you protrude your tongue or stick your tongue out and looking for any deviation or unusualness to that. It looks good. Okay. Okay, so now I'm just gonna go through and look at your neck. So first I'm just gonna look at the skin, look for any lesions, swelling, abnormal pigmentation or anything. I'm going to look at your thyroid gland, look for any unusual masses or enlargements, and then also your trachea, look and see if there's any deviation of that. It looks good. And then I'm gonna go and I'm gonna palpate your neck, if that's okay, around your thyroid gland. So I'm just gonna feel any unusual swelling or lumps or masses. And then I'm gonna have you swallow for me. Good. And then I'm gonna use my fingertips in the gaps here and feeling for the trachea, feeling for any deviation. Go ahead and swallow again for me. Just feeling for the tug and feeling for a normal alignment with that. And then I'm going to next palpate your lymph nodes. So I'm just going to feel around your neck, if that's all right. Mm-hmm. So first I'm going to feel for preauricular lymph nodes, postauricular lymph nodes, occipital, and then tonsillar, submental, or submandibular, submental, and then superficial cervical in front of the SCM, deep cervical behind, posterior cervical behind the SCM, and then supraclavicular down above the clavicle. I'm just checking to feel if any of them feel enlarged or irregular or a hard consistency or soft versus normal. And then I'm also going to auscultate the carotid artery, just checking for signs of bruit. And then usually I would not do this unless my patient shows signs and symptoms of like seizure, headache, or stroke, but I'll just listen here. It's gonna be right above at your neck, if that's okay. Sounds good. And then next I'm going to do just testing your spinal accessory nerve. So go ahead and shrug your shoulders for me and just resist my pressure. Don't let me push down. Good. And then go ahead and turn into my hand and resist my pressure. Good. And turn into the same and resist my pressure. Good. All right.